As a physician who has dedicated my career to treating pancreatic cancer, I've had the privilege of working alongside some of the most dedicated professionals in medicine. And today, I want to talk about a group of individuals who are, without a doubt, the very heart and soul of our patient care teams. While doctors like myself focus on diagnosing the disease and formulating a treatment plan, the chemotherapy, the radiation, the surgical strategies, it is the nurses who make that entire journey possible. They are more than caregivers. They are the navigators, the guides, and the constant, reassuring presence at the bedside. They are the ones who transform a clinical plan into a lived, manageable reality for our patients and their families. They are the emotional anchor in the storm of a pancreatic cancer diagnosis, the steady hand that our patients hold, and the watchful eyes that ensure every detail is attended to. In the complex world of oncology, they are the indispensable partners who truly bring care to life. When we talk about managing pancreatic cancer, we're talking about managing a cascade of incredibly challenging physical symptoms. This is where the profound expertise of our oncology nurses comes to the forefront. They are the true frontline of symptom management. Pancreatic cancer and its aggressive treatments can bring about debilitating pain, profound nausea, persistent fatigue, and significant nutritional challenges. Our nurses are the masters of this domain. They don't just administer medication, they anticipate needs. They possess an almost intuitive understanding of a patient's comfort, observing the subtle cues, a slight grimace, a change in posture, a shift in tone that tell them pain is breaking through. They are relentless in their pursuit of relief for the patient, working with the medical team to meticulously adjust pain control regimens, finding the precise balance that allows for function without sedation. They are experts in nutritional support, understanding that maintaining weight and strength is a battle in itself. They work with patients to manage the side effects of chemotherapy, offering practical strategies for combating nausea and fatigue, and ensuring that complex medication schedules are followed flawlessly. They are the first line of defense, the vigilant guardians of our patients' physical well-being, working tirelessly to ensure that each day is as comfortable and dignified as it can possibly be. One of the most daunting aspects of a pancreatic cancer diagnosis is the sheer volume of complex medical information that patients and their families are suddenly expected to absorb. This is where our nurses shine as masterful educators and translators. They possess the unique skill of taking dense, clinical jargon, the language of pathology reports, imaging scans, and treatment protocols, and breaking it down into clear, understandable, and actionable information. They sit with families and patiently explain what to expect from a particular chemotherapy regimen, what the side effects might be, and, crucially, how to manage them at home. They teach family members how to care for ports, how to administer subcutaneous injections, and how to recognize the warning signs that necessitate a call to the clinic or a trip to the emergency room. This act of education is an act of empowerment. It demystifies the medical process, reduces fear of the unknown, and gives patients and their families a sense of control in a situation that can feel overwhelmingly chaotic. By equipping them with knowledge, nurses empower them to be active participants in their own care, transforming them from passive recipients of treatment into confident partners in the fight against their disease. This daily, patient education is a cornerstone of compassionate and effective cancer care. Beyond the physical and the clinical, there is the profound emotional and psychological toll of a pancreatic cancer diagnosis. Our nurses are the emotional bridge that connects the sterile reality of the hospital with the deep, human fears and hopes of our patients. They are the ones who have the time, and who make the time, to sit, to listen, and to simply be present. They create a safe space where patients can voice their deepest anxieties, their frustrations, and their grief without judgment. They hold a hand during a difficult conversation, offer a word of reassurance before a scan, and celebrate the small victories along the way. This emotional support is not a secondary task. It is an essential therapeutic intervention. In this role, they also become the patient's most powerful advocate. Because they spend the most time with patients, they develop a deep understanding of their values, their wishes, and their concerns. They are the ones who will notice that a patient is struggling with a particular side effect more than they are letting on, or that a family is feeling overwhelmed and in need of more support. They then carry these concerns forward, acting as the patient's voice within the broader medical team, ensuring that the care plan is not just clinically sound, but also aligned with the patient's personal goals and quality of life. This advocacy ensures that the patient remains at the absolute center of every decision we make. The journey through pancreatic cancer treatment is rarely linear. It involves a complex web of appointments with surgeons, medical oncologists, radiation oncologists, dietitians, social workers, and palliative care specialists. Coordinating this intricate dance of care is a monumental task, and this is where the role of the nurse, particularly the nurse navigator, is absolutely indispensable. They are the ultimate coordinators, the conductors of the orchestra, ensuring that every member of the team is working in harmony. They are the champions of continuity, ensuring that nothing falls through the cracks as a patient moves between different departments or transitions. From the hospital back to their home, a nurse navigator will schedule appointments, follow up on test results, and facilitate communication between different specialists, ensuring that everyone is on the same page. They are the central point of contact for the patient and their family, a single, reliable person they can call with any question or concern. This seamless coordination prevents delays in care, reduces confusion and anxiety, and ensures that the patient's journey is as smooth and efficient as possible. They provide a safety net, a crucial layer of oversight that holds the entire complex care plan together, providing a continuity that is both practical and profoundly reassuring. So, as we think about the fight against this formidable disease, I want to end with a message of profound gratitude and a call to action. The partnership between a patient and their oncology nurse is one of the most powerful alliances in all of medicine. To every patient and every family member navigating this journey, I urge you to see your nurses as your essential partners. Lean on them. Communicate openly and honestly with them about your fears, your symptoms, and your goals. Ask them your questions, no matter how small they may seem. They are there for you, armed with expertise, compassion, and an unwavering commitment to your well-being. Recognize the immense value they bring, the countless acts of kindness and clinical excellence they perform every single day, often away from the spotlight. They are not just part of the team. In many ways, they are the glue that holds it all together. They are, and always will be, essential and cherished members of every pancreatic cancer warriors team. Thank them, partner with them, and trust in the incredible care they provide.